All right, everybody, thank you all so much for joining me today. My name is Taylor Jackanow. I am your point of contact for a few of the benefits you now receive with All Savers United Healthcare. Healthiest You is considered your telehealth benefit, your virtual healthcare benefit. That is providing you access to a doctor over the phone 24/7 for no cost. You also have access to Best Doctors, which is going to be your expert second opinion service. So a little bit of background for everybody. Healthiest You has been a part of All Savers policies since 2013. The purpose is to help eliminate unnecessary doctor visits for minor acute illnesses. So next time you're sick with any cold, flu, allergy, pink eye, we are able to diagnose you over the phone based on your symptoms. It's more convenient for you. When you go to utilize Healthiest You, we are connecting you with a board certified physician. This is not a nurse, it's not a physician's assistant, it's not an intern. These doctors have an average of 20 years in the medical field, minimum of 5. So we do not hire any doctors just straight out of med school. These doctors see patients in person on a regular basis, and then they're able to work for us on their time off and take the consultations. So these physicians are available 24/7 through phone call or video call, and we are able to connect you with a doctor within the hour of you placing the request. We do a little over 5,000 consultations a day across the country. Our busiest day last year was the day after Christmas. We did a little over 11,000 consultations in one day alone. So that's just a little bit about Healthiest You, 24/7 access to a doctor over the phone, helping eliminate unnecessary doctor visits for small illnesses, things we would go see our primary care physician for. Now you also have access to Best Doctors. That just became embedded in All Savers policies August of last year. Best Doctors has been around since 1989, so this is not their first rodeo. The purpose of Best Doctors is to get you a second opinion for any medical uncertainty you may have. So I hope you never have to use it, but it's here just in case. We have a little over 40,000 Best Doctors in the U.S. and 10,000 internationally that cover over 450 different specialties. So not only are we able to cover minor illnesses with Healthiest You, but now we're able to cover them more complicated with the addition of Best Doctors. So first, we'll talk a little bit about Healthiest You. Typically, when you get sick, you go see your primary care physician in person. That's what we've been doing for years. Take off of work, go see your doctor, sit in a couple different waiting rooms, expose yourself to more germs, maybe pay a copay depending on your plan type, or maybe you go to urgent care or the emergency room when you get sick. Maybe it's late at night or you're traveling and those are your only options. Or maybe you do absolutely nothing when you get sick. You just don't want to be put through the hassle of having to go see somebody in person, which we totally understand. Well, now that you have access to Healthiest You, we can help you avoid all of these inconveniences and connect you with a doctor from the comfort of wherever you are. These are some of the reasons why people end up in the emergency room. I am currently suffering from allergies and a sore throat, but am I going to go to the emergency room? No, I will honestly probably use Healthiest You later on today if this Dayquil does not help. Would I go to the ER for anything minor? No, that's like $500 just to walk through the door. Why would I do that when I can use Healthiest You instead? And it's free. It's going to save you a lot of time, a lot of money, a lot of heartache. Please keep in mind we are as available as the emergency room. So next time you're traveling for work or vacation, you get sick on the road, you can use Healthiest You instead of going to urgent care or the ER. If you're sick at 10 o'clock at night, 2 o'clock in the morning, remember our doctors are available 24/7. There are a couple different ways you can go about utilizing Healthiest You. I'm going to show you how to use the app in a minute. That's going to be the preferred method of utilization. It's more convenient because you typically always have your cell phone on hand, so it's with you all the time. That's like having a doctor in your back pocket. So we definitely recommend using the app if you can. Now, if you don't have a smartphone or a tablet, that's okay. You can still use our member website to request a consultation at the click of a button. And then if you don't even have internet, it's fine. Just dial our hotline phone number, still available 24/7. You will have to do your medical history and pharmacy info over the phone, and then we will have a doctor call you back. So tech savvy or not, you should be able to use this. However, there are a few more features on the app than our website. I will explain the differences as we get there. You're also going to have Best Doctors literature located on your Healthiest You app as well. So let's talk a little bit about Best Doctors. This is benefit number 2. Please do not confuse this one with Healthiest You. This is completely separate. The main purpose of Best Doctors is to get you a second opinion for more complicated issues and illnesses. So we're no longer talking cold and flu. Now we're talking like serious problems. So I hope you don't have to use it, but it's here just in case. In order to use it, you call this phone number, 866-904-0910. You will find that on the Healthiest You app. That phone number is available Monday through Friday, 8 a.m. to 9 p.m. Eastern Standard Time. They're based in Boston, so that's perfect, same time zone as you. Best Doctors is also free for you to use. So here are a few examples of what you can get a second opinion for. You can honestly almost get a second opinion for anything nowadays. Surgeries is definitely the most popular. So if you're ever recommended to go get a surgery, before you go under the knife, get a second opinion. Make sure the surgery is 100% necessary or if it's even in your best interest. Or maybe you're having a difficult time being diagnosed. Maybe you've been to multiple doctors, symptoms are not improving, use this. Or maybe you were diagnosed with something pretty severe. Get a second opinion right away to make sure you are diagnosed accurately from the beginning. So again, all you're doing is calling the phone number. You first talk to member services. They will schedule you a phone call with a nurse to gather background information from you. Then you will have an additional phone call with the doctor. From there, you need to sign a DocuSign. That will give us permission to obtain your medical records. From there, we'll have a separate team of people gather your medical records, hand them over to the doctors that specialize in your illness. From there, doctors will do their research. As soon as they're done, they'll provide you with a very detailed 20, 30-page report with what they have found. I will make sure you all have a sample of what that report looks like. So, turnaround time. You're looking at 2 to 6 weeks. It all depends on the complexity of your case. It also depends on how fast your doctors are in releasing your medical records. So that's the only reason why this is not happening overnight. Right now, about 80% of our members were able to improve their treatment options. So even if you were diagnosed with something in the past, maybe the illness is still affecting you today, you can still use Best Doctors right now to make sure you're getting all the appropriate treatment for the illness. About 45% of our members were able to improve their diagnosis. Almost 40% of our members were helping people avoid unnecessary surgeries. I will also share with you the link to bestdoctors.com. Lots of member stories and testimonials on there that you can also read through. Here is just one of them. So one of our members in her mid-50s was diagnosed with ovarian cancer. She went through with what her doctors recommended, which was chemo, getting her cervix and ovaries removed, getting lymph nodes removed. In the middle of all of this treatment, then decides to get a second opinion. Gets a report back from Best Doctors, finds out she was actually misdiagnosed, never had cancer to begin with. What she really had was a benign cyst. They thought the cyst was cancer, moved forward with all these unnecessary procedures. Now, on the bright side, we were able to help her avoid 17 rounds of chemo. She was recommended to go through 18. She only went through 1, which was enough anyway because she didn't even need that in the first place. Avoiding 17 rounds of chemo, you're looking at a savings of about $50,000. Obviously, that's a lot of money. That's why All Savers put this into place, to make it more accessible for you to get a second opinion. If you did not have access to this, it would require a lot of work from you to get a second opinion on your own. You'd have to find another doctor, get a referral to go see them, make appointments to go see them, maybe pay co-pays depending on your plan type. So now you're spending time and money. Whereas if you have access to this, we can do all the work for you and it won't cost you anything. So my recommendation to my members is that if you are dealing with anything more complicated than a cold or flu, it does not matter the severity of the issue, just please do yourself a favor and get a second opinion. No harm, because even if we can at least confirm the illness for you, at least you can have some peace of mind you were not misdiagnosed. We also have people use Best Doctors because they were taking really expensive medication, meds costing them $500, $600, $700 a month. I said, okay, get a second opinion. Make sure whatever you're on is 100% necessary. We can also determine if there's any less expensive options out there for you. So that's going to be a high-level overview of getting a second opinion through Best Doctors. Any questions before I show you all how to utilize the Healthiest You app? All right, so this is what the Healthiest You app looks like. Healthiest You, all one word, HY with the blue circle around it. We're going to recommend you set up your Healthiest You account before you actually get sick. Highly recommended, and it's very easy to do. To set up your account, all you will do is click register down at the bottom middle of the screen. Everybody will go ahead and select employee as their membership type. I know there's a decent amount of you who cover family members on All Savers, spouses and kids. So if those family members are 18 and over, they can also use our app and website and set up their own personal account with us. Those family members 18 and over can also select employee as their membership type. It's really not going to make a difference. Then we ask for the last name, birthday, and zip code of the primary member. Spouses and dependents, be careful. We don't want your birthday. We want the birthday of the primary account holder every single time. So we enter these three things. You click next. You'll see your name pop up. You select your name, and then you set up your email and password. After you set up your email and password, you're asked for your phone number. That's going to be your cell phone number. That is the number the doctor will call you back at. So I'm going to log into my account here. After you provide us with your phone number, you need to agree to terms and conditions. Then you're also asked if you would like to set up a PIN, which looks like this. You can either set one up or skip over it. It's just like an additional password. I'm just going to skip over it. This is what your dashboard looks like. First, I'm going to show you how to call the doctor. Then I will show you your settings and explain to you where you have to fill out medical history, pharmacy info ahead of time. All of my information is already filled out. So if I was sick right now, to connect with a doctor, all I need to do is click the blue button at the top that says request a visit now. It says who needs help today. The only people you'll see here is yourself and your minors. So if you do cover minors with All Savers, they'll automatically be on your phone. Again, if you cover adults, they have to go set up their own account. I don't have any minors, so I'll just select myself. It says we need to know where you will be. I'm currently in Arizona, but let's say I go to Florida. I will select Florida. So that way I'm connected with a doctor licensed in that state. So please keep in mind you can use this anywhere in the country. If you're traveling, just tell us wherever you're physically located, because doctors cannot prescribe medication over state borders. So you select your state, then you're going to select phone call or video call. If you want to talk face-to-face with a doctor, do video. You just need to remember to keep the app open the entire time. If you close out of the app in a video call, we will not be able to reach you, but we will send you a notification to open the app back up. So just remember, if you do video, the app will have to be open. Then you're asked, when is a good time? As soon as possible means within the hour. Spring and summer, not too many people are sick. It could take maybe 5 or 10 minutes for the doctor to call you back. Flu season, on the other hand, that's the time of the year when it could take up to an hour for the doctor to reach you. You also have the option to click the drop-down arrow and schedule a phone call for later on today. I do not recommend you wait till tomorrow because by then you're even more sick. So the sooner you connect with the doctor, the better. Then you're asked for your contact info, which is just going to be your cell phone number. This is the number the doctor will call you back at. Just a heads up, we will always be calling you from a blocked number. That's because the doctors use their own cell phone, so this is to protect their privacy. So if you miss the first call from the doctor, we will call you a second time. If you miss the second call from the doctor, we will call you a third time. If you miss all three, then this entire consultation is canceled. You need to come in here and start over again. 3 strikes, you're out type of deal. You can also opt in for a text notification as well. Then you're asked, what's the reason for your visit? In the drop-down, you can choose between all these different illnesses. Cold, cough, earache, flu symptoms, prescription, refill. So what does this mean? Let's say, for example, you take an FDA-approved drug. Blood pressure medication, thyroid medication, birth control inhaler. Let's say you are about to run out of your script and your doctor cannot see you for another week or 2. Use Healthiest You. We can get you a refill a couple times a year. We just cannot get you a refill 12 months in a row because we're not the ones who prescribed it to you in the first place. And then if you called in for a controlled substance, antidepressants, Adderall, Xanax, anything like that, you will be told to go see your doctor in person. We just can't prescribe controlled things over the phone. You can also call in for minor pain, poison ivy, sinus infection, sore throat, upset stomach, UTI. If you don't see the reason for your visit, you can select other and just type it right in. So for today, we'll just do a sore throat. Share my visit results with my primary care physician. This is optional. I will show you under your settings. If you want to give us your doctor's contact info, you can. And then you can decide if you needed the result of this phone call faxed over to your own physician or not. That's a feature only available through our app. You can't do that through our website. We'll leave it blank for now. Photos is also optional. If you have something like pink eye, poison ivy, a rash, a bug bite, a burn, please share pictures with the doctor. It will definitely help out with the diagnosis. We don't need photos right now. Then you're asked for your pharmacy info. I will show you where you can fill that out ahead of time, just in case we have to prescribe you something. And then this is your confirmation page. This is where you make sure everything looks accurate, especially your phone number, because we've had some people accidentally give us their house number. We call their house, guess who's not home? The member. So please make sure it's the best cell phone number for you. And then you scroll to the bottom of the page. It's reminding you the cost of the phone call is free. It's already covered for by All Savers. You do not have to pay for this consultation. You then have to answer without Teladoc, which is just the owner of Healthiest You. Where would you have gone if this was not available? For example, your primary care physician. You then have to agree to terms and conditions. You then click the blue button that says confirm. From there, we'll let you know you have an active consultation and the doctor will be calling you back shortly. So that's how easy it is to get connected with a doctor when you're sick. Much more convenient than having to go see a doctor in person for anything minor. The only thing you will have to pay for is the medication if we prescribe you something. Let's say you have a sinus infection. Maybe we prescribe you amoxicillin, penicillin, a Z-Pak, whatever the doctor thinks is necessary. When you go get it from the pharmacy, you will either pay your All Savers copay or the cash price, whatever is cheaper. And then one thing you just want to remember is that these phone calls do not generate insurance claims like your in-person visits do. These phone calls are not going towards your deductible. So the more we can use this together as a group, less likely premiums and rates keep going up at renewal. saving everybody money. Any questions before I show you your settings? All right, so to get to your settings, you're going to click the little circle in the top right-hand corner of the page. On your phone is probably a little blue dot. In the drop-down menu, you're going to click on Medical Info. I do not have a 12-year-old. That is my 24-year-old brother. There's a demonstration. If any of you have minors, this is what your phone is going to look like. The minor will pop up on your phone. Okay, just let me know if you can still hear me. Okay, no worries. So here, let me just go back to where we were. So from the dashboard, to get to your settings, you're going to click the little circle in the top right-hand corner. In the drop-down, you click on Medical Info. Again, I do not have a 12-year-old. It's there. It's a demonstration. I'm just going to click on myself. And then here is everything you as a member would have to fill out. Your medical history is mandatory. That is your height, your weight, any medication you take, medical conditions, allergies. The doctors review that prior to calling you. That way we don't prescribe you something you could be allergic to. Doctors is optional to fill out. This is where if you want to give us your doctor's contact information, go for it. And then you can decide if you want the result of these phone calls faxed over to your own physician or not. Most of our members who do that are parents with really small kids. They like to include the pediatrician in on what's happening just in case the pediatrician wants to follow up with the parent. You can only do this through the app. You can't do that through the member website. Pharmacies, I do recommend you fill that out ahead of time as well. So if we click on pharmacies, you click add a pharmacy in the bottom left-hand corner. You can find your pharmacy by either your current location, zip code, or city. I personally think it's easier to do this by zip code. So if you type it in and you click search, first it's going to show you a map. Right next to map across the top, you can click on list. Here's a list of all the pharmacies near me. And you can add more than one if you need to. And then you can always adjust this in the future if it ever changes as well. So just in case we prescribe you something, we have to know where to send it. You don't have to do anything with images. If you ever share pictures with the doctor, all of your history of pictures will be stored there for things like pink eye. Visits. As soon as you use Healthiest You once, all of your visit history of phone calls is stored there. Cases, you don't have to worry about. We're all done here. I'm going to click the blue arrow in the top left and it will take me back to family members. Now I'm going to show you how to add family members. I know there's some of you who only cover yourselves on the medical coverage with All Savers, like employee-only coverage. Well, if you have family members living in your house, even though they're on a different insurance policy, you can add them to this Healthiest You account. So that way, if the rest of your household gets sick, we can connect them with a doctor for free as well. Adding family members, this can only be done through the app, not our website. So to add a family member that lives in your house but is not covered for by All Savers, you're going to click the Add New button right above your name on the right side of the page. It's going to ask you for the relationship you have with this individual. In the drop-down, you can choose between daughter, partner, husband, parent, son, wife. Maybe you have an in-law living with you or a sibling, cousin. It does not matter their age. You have to fill out their name, birthday, gender, language, contact information. If you're adding a minor, leave the phone number as yours. So that way the doctor can call you, the parent, instead of calling your child. And then on the other hand, if you're adding an adult, 18 and over, you have to put in their cell phone number. So that way the doctor will call that adult back instead of calling you. You fill this out, you click continue, and then it will take you right back to this page. So let's just pretend I added a minor. They will show up on this page just like you see Max. So that way if my child got sick, I can use this on their behalf. Now, the tricky part is if you have to add an adult 18 and over. First of all, they will not show up here. They will be invisible. Never going to see them. Second of all, since this adult is not covered for by All Savers, they do not get to use the app or the website like you do. So what are they supposed to do when they get sick? They will dial our hotline phone number, 866-703-1259. They'll dial that number. They'll have to do their medical history and pharmacy info over the phone with the call center. Call center rep will have a doctor call them right back. So the good news is that the phone call for them is still free. It is still available 24/7. Yes, we can still write them a prescription if necessary. The only difference here is that since they're on a different insurance policy, that's the only reason why they don't have access to the online platforms. So just to recap, if you add a minor, they're going to pop up on your phone so you can use this on their behalf. If you add an adult, they're not going to show up here. They'll be invisible. And they can only use the hotline number to connect with the doctor. So we just want you to be aware this service is available to the entire household, whether they are on the insurance or not. The Add New button is strictly for family members not on the insurance policy. If your family members are already insured with All Savers, do not come in here and add them again because that will cause duplicates. Any questions about settings or adding family members? All right, well, if anybody needs any assistance adding family members to their Healthiest You account, call me offline and I can help you. The last thing you have to know about the app is the message center, which is at the bottom of my phone. That is where you will get your excuse notes. So for example, let's say you have to be out of work or your kids had to be out of school for 24, 48 hours. Yes, we'll write you an excuse note. You'll find it in your message center. You just need to remember to request the note from the doctor while you're on the phone with them. If you forget to request the note from the doctor, there is no way for you to call the doctor back, so call me. I'll request a note for you and I can email it to you. Not a problem. The message center is only available through the app, not our website. That is everything you have to know regarding Healthiest You. 24/7 access to a doctor over the phone in all 50 states is open to your entire household. Now, you will also see Best Doctors in the middle of my phone. If we click on that, it will bring you to this page. In the middle of the page, there's the phone number you call to use Best Doctors to get a second opinion. Monday through Friday, 8 to 9 p.m. Eastern Standard Time. Now, Best Doctors is also free for you to use. Doesn't generate claims. However, the only people who get to use Best Doctors are those on the insurance policy. So Best Doctors just cannot be used by the extra family members in the household. Now, we already know the main purpose of this is to get you a second opinion. I can swipe through my phone. These are other services you have access to in addition to the second opinion. I'll make sure you have the flyer that talks about all 6 of these services. One popular one is called Ask the Expert. This is for general medical inquiries. Example, my colleague just had a newborn baby. He had about 30, 40 questions he needed to ask a specialist. Instead of doing all the research himself, called Best Doctors, gave over the questions, he had answers within 48 hours. So he wasn't necessarily ever ill with anything, but he was still able to take advantage of this. You also have access to treatment decision support, which is exactly what it sounds like. If you're ever given multiple treatment options, you're having a hard time deciphering which one is best for you to undergo, call Best Doctors. We can help you make the educated decision. Finding a best doctor. Let's say you need to have a surgery or treatment. You want to know the top doctors in your area who can do the procedure, but they also take your health insurance. Call Best Doctors, tell us what you need to have done. We'll give you a list of the top surgeons in the area. Just keep in mind, if you say something like, I think I need surgery on my shoulder, I think I need surgery on my knee, guess what? We will probably recommend you get a second opinion just in case, because there's always a possibility you might not need the surgery, you might just need physical therapy. So those are a few other services you have access to within Best Doctors, but your main component is the second opinion. All of my contact information is on top, resources down at the bottom. If anybody needs any assistance using either benefit throughout the year, please do not hesitate to reach out to me. So my only suggestion right now, obviously set up your Healthiest You account before you get sick, because the last thing you want to do when you're sick is fill out medical history. Any questions that I possibly didn't